family member of Utah Zika-patient infected with Zika virus, puzzling health officials. Authorities are scratching their heads over how a family member who helped care for the elderly Utah man who died of Aedes was infected with the virus, state and federal officials announced Monday. The infected family member helped care for the deceased patient, the first Zika-related death in the continental U.S., but had not traveled to a Zika-affected region or had sexual relations with the deceased, presenting the alarming possibility that the infection spread through a new route, health officials said. "This is a unique situation," CDC Director Tom Frieden told. "This is the first time where there is a suspected spread of one person to another outside of sexual transmission." The infected person, who recovered quickly according to officials with the Centers for Disease Control and Prevention, was in close contact while providing care for the deceased patient. During that time, he could have been exposed to that individual's sweat or tears or bodily fluids, Friden said. But Friden described the transmission of the virus as unusual. There are currently 1,306 travel-related Zika cases in the continental U.S. If this unexplained transmission was occurring regularly, it's likely we would have seen it before, he said. "There is uncertainty about how this new case contracted Zika," said Garrett Edwards, health official with the Salt Lake County Health Department. "But we do not believe that there is risk of Zika transmission among the general population in Utah based on what we know so far." The Aedes aegypti and Aedes albopictus mosquito species capable of carrying Zika virus are not present in Utah, Edwards said. CDC scientists are investigating the possibility that the virus mutated or that an infected mosquito may have returned to Utah from a Zika-affected region in the deceased Zika patient's clothing or luggage. Health officials are also investigating the elevated levels of the virus present in the deceased patient's blood. The deceased, who traveled to a Zika-affected region, had concentrations of the virus 100,000 times higher than samples of other infected people, the CDC said. The newly infected person showed symptoms of Zika but did not exhibit the same high concentrations of the virus, officials said. Health officials are currently interviewing and collecting samples from family members and healthcare workers who were in contact with the deceased patient. The Utah person's infection is the fifth case of Zika virus reported in Utah, according to CDC data. As of July 13, the CDC has documented 1,306 cases of Zika virus related to travel in the continental U.S., including 285 cases in New York State, and 14 instances of sexual transmission nationwide. There are 2,916 documented cases of Zika virus in U.S. territories, the vast majority of which were acquired locally.